Dear students, it's a great pleasure to be with you again on this new and special PCE edition. In light of the COVID-19 pandemic and social distancing measures still in place, the PCE will not be held as an in-person workshop this year. However, we wish to maintain our tradition of PCE, therefore Arpik and I decided to go for an online version of the workshop. During the following hour, I will try to provide you with the necessary information on the patient counseling process. This presentation will also serve as a tutorial session for the 5th year pharmacy students at the Department of Pharmacy, University of BATNA2. Before I proceed with the explanation of the patient counseling process, I would like to start my presentation with a brief introduction on the evolution of the pharmacy profession. In fact, the role of pharmacist has largely evolved over the 6 past decades. It has moved from
the compounder and the supplier of the pharmaceutical compounds into a provider of services and information, and thus a provider of direct patient care. So now we can say the responsibility of the pharmacist is to provide patient care, which means to take a full responsibility or to be accountable for the patient's pharmacotherapeutic outcomes. In order to have a positive pharmacotherapeutic outcome, the medication itself needs to be efficient, which means we need to select the right medication for the right patient, and to do so we need to rely, of course, on studies, on guidelines, on recommendations, and to study each patient condition separately. But the medication itself could not be useful or could not give the effect that we are looking for when it's not taken properly. So when there is a problem of the proper use of this medication, whether because the patient has not been well informed, or because it has been informed but like in a wrong way, this could lead to negative pharmacotherapeutic outcomes. Just to open a bracket about pharmacotherapeutic outcomes, what I mean by pharmacotherapeutic outcome is that when we give or when we prescribe a medication for a patient, we are looking for a result. Either it is to cure a disease, or to relieve a symptom, or to reduce, for example, pain, or to prevent a problem, health problem, etc. So these pharmacotherapeutic outcomes, in order to be met, we need to select the right drug for the right patient, for the right condition, and to use the drug properly. Not only that, the patient also needs to be adherent to the therapeutic regimen. What we mean by adherent to the therapeutic regimen, which means he or she needs to take his or her medication like it was instructed by the physician and the pharmacist without interruption. Studies have shown that when the drug is not used properly, or when the patient is not adherent to his treatment, this can lead to several negative results. One of those results is the poor disease management, which means, for example, we give an antibiotic for a specific infection. When we use an antibiotic, for example, for 3 days and we stop the treatment, the infection will persist, and then we will have a poor disease management. It also leads to emergency room revisits because of the complication. For example, we take more drug than we are supposed to take, or we take it at the wrong time, at the wrong route, etc. It results also in longer hospitalizations. So instead of, for example, to be hospitalized for 3 or 4 days, this improper use of the drugs will lead to a longer stay at the hospital. And of course, this leads to increased morbidity and mortality, and indirectly will result in increased healthcare costs. So the purpose of my today's presentation is to help you students, or to help pharmacists who are among us, to provide effective patient counseling, to develop communication skills, because in order to be a good counselor, in order to be a good pharmacist who can explain correctly the medication to the patient, we need to develop some communication skills that need training. And we will see that we have different types of communication skills. Also, this presentation will help you to identify the barriers to providing patient counseling and to be able to eliminate these barriers in order to make the optimal counseling session as possible. And of course, I will help you to learn how to encourage patients to seek counseling, because the counseling should be provided, but it should be a continuous process, and it should not stop. So first of all, let's start with a small definition of patient counseling. So patient counseling could be defined as providing medication information to the patient or their representative. For example, we can receive a prescription, but the person who is bringing the prescription to the community pharmacy, for example, is not the patient themselves, but someone from their family, a father, mother, sister, or even a friend. And this medication information could be provided either orally, so this is the case in community pharmacy, so face-to-face information, or could be also provided over the phone. Another kind of information is the written information. For example, it's the patient information leaflet or other printed material. For example, the pharmacist could prepare printed material, or it could be provided, for example, by the laboratory that has produced the drug. And of course, as much as possible, it's better to have both the oral counseling and the written counseling. And this counseling will aim to provide proper direction on not only the medication or about the scientific information about the medication, but also about how to use this medication, how to identify side effects and how to avoid them, and to manage them if they happen, how to store the drugs, and how to make lifestyle modifications that help also the pharmacological treatment. Why do we do a patient counseling? We provide patient counseling because it's both beneficial for the patient and for the pharmacist. I guess most of you know the benefits of the patient counseling to the patient, but we will see today that not only it's beneficial for the patient, but it's also beneficial for us as pharmacists. Let's start with the benefits to the patient. With regards to the benefits to the patients, patient counseling will help our patient to understand their diseases and the role of each medication. This is a problem that we encounter most often at the hospital or at the community pharmacy, is that patients may receive several drugs, but the problem is that they do not know each drug is for which indication. So, for example, he can, or the patient, he can have, for example, treatment for hypertension, for diabetes, for ulcer, for pain, and he doesn't know which one is for which indication. And whenever he feels pain, he may take, for example, instead of taking an analgesic, he may take, for example, a treatment of hypertension, which poses a lot of problems. Another also benefit to the patient is improving their adherence to the treatment plan. Of course, in accordance with in collaboration with the physician, we implement what we say a treatment plan, And this treatment plan, of course, involves several points. We will discuss them later on. And we need our patients to adhere. And when the patient understands why he is taking this medication and why he is taking it at this time with this way, he will be more adherent to the treatment, and he will understand, or she will understand, the consequences of interrupting the treatment. So let's say that the patient counseling is very, very, very important, and studies have shown that it increases or it improves the adherence enormously. Also, it improves the therapeutic outcomes, as I explained later on. So it will decrease the length of hospitalization, and it will give better treatment outcomes, etc. And it will decrease, of course, the incidence of adverse drug reactions. What we call adverse drug reaction is another term for side effects. And of course, it will help the patient to self-manage these adverse drug reactions, which means he will learn, or she will learn, how to avoid or how to prevent these adverse drug reactions, and how to act once they happen, how to manage them once they occur. Also, it helps the patient avoid potential drug interactions, of course, either with the drugs that are prescribed or with the OTC, so over-the-counter drugs, which means the non-prescription medication, with any other herbal medication or herbs he is taking, and of course with any other, like for example, food or something else he is taking. Also, it will reduce the unnecessary health care costs, and of course, whenever we manage the treatment correctly, the costs will decrease. Is it clear so far? Now that we talked about the benefits of patient counseling to the patient, let's talk a little bit about the benefits of this patient counseling to us pharmacists. We need to know that when we give a patient counseling, which means we are establishing a relationship, or a professional relationship with our patient. And when we establish this professional relationship, which is a caring relationship, we improve our rapport with the patient, and this will in the future enhance our professional status in the view of patients and other healthcare professionals. Let's say that it will a little bit erase the image that unfortunately many patients have on pharmacists, that we are only sellers of drugs, and that we only are interested about the commercial part of the pharmacy. And I guess there is no better thing than the communication with patients and the patient counseling to improve this image and to enhance our professional status. Also, it will enhance our job satisfaction, and I can assure you that this is a feeling that no one can describe. Whenever you feel that you have provided useful information to the patient, and then when you do your follow-up, you feel like the patient's condition improved because he is now using his drug or her drug correctly. So this gives you really a good job satisfaction, and you feel like you have contributed to a positive outcome. And there is something else that we are discussing since like 2012, making the counseling services payable, which means that the pharmacist has a revenue from the drug itself, but he could or she could have revenue also from the services provided at the community pharmacy, for example. And this happens in several countries, but still it's not that large, it's still limited. And we hope that we will arrive one day to this point. Now, we have talked about the definition of patient counseling and its benefits and why we are doing it. I need also to talk to you about the settings or the practice settings where we provide patient counseling. You need to know that patient counseling is not only provided at the community pharmacy or at any ambulatory care setting, but it also can be provided in inpatient care. For example, when a clinical pharmacist is present in the ward, he can provide or she can provide information to the patient that may help improve their treatment experience. Also, it can be provided in home cares or in long-term cares or whatever place that has a pharmacist in the facility. And when do we provide the patient counseling? The patient counseling could be provided whenever it's possible. For example, we can provide it during a community pharmacy visit, for example, someone who comes even without a prescription to buy something at the pharmacy or a non-prescription medication. And now that we are, as I said, pharmaceutical care providers, we should not only have this automatic action of just selling without giving any information about what we sell. We should also dispense, I hate the word sell, I guess I should say dispense the drug. Whenever we dispense the drug, we need to also give a bit of information about that drug. We can also provide the counseling when we fill or refill the prescription. So for any new prescription or an old one, also we need to make a reminder, and we need to check that what the information that we gave last time was correct and that the patient is taking his or her drug correctly, etc. We can also provide patient counseling on admission at the hospital. We can start first of all by taking a medication history interview and make sure that the old drugs are taken correctly before moving to the new ones. Throughout the patient, the inpatient stay, so when the patient is hospitalized, we can, whenever we pass to see the patient, we can also do patient counseling. And of course, and most importantly, prior to any discharge from the hospital, so just immediately before the patient leaves the hospital, we need to give him sufficient information. And of course, at discharge, and in this case, at discharge, it will be the role of the community pharmacist. So prior to discharge, it's the hospital pharmacist or the clinical pharmacist, and at discharge, it will be the role of the community pharmacist. Now that I explained to you where and why and when we do patient counseling, I will talk about the process itself of patient counseling. How do we do this procedure? You need to know that if we need to divide, let's say, the patient counseling into different stages, we will have around 3 stages. First of all, it's what we call the introduction. It's just a kind of preparation for the session of counseling and kind of an opening. There is also a process content, and this is actually the body of the patient counseling, in which we give, we first of all gather information from the patients that will help us later on provide the necessary information. And the last stage is the conclusion, because we need to finish the session and encourage the patients to make future counseling. So you can take the patient counseling like the preparation of thesis or dissertation. You have introduction, you have the body, and you have the conclusion. As simple as that. Let's start with the introduction. So what do we call introduction is, first of all, establishing a caring and ongoing relationship with the patient. What I mean by establishing a caring and ongoing, it means that this relationship, you have to always put in mind that this patient, that you will see this patient several times, and you need to make sure that he will come back to your pharmacy. And believe me, when a patient is satisfied with the services you provide, he or she will automatically come back asking for more. So it's not a one-time relationship, it's an ongoing or continuous relationship with the patient. Before starting, you need to identify your patients, which means when you receive a prescription, you need to make sure that the person in front of you who is giving you the prescription is the patient, him or herself, and it's not someone else. In order to be able to address your patient correctly, because you cannot tell, for example, a family member, you need to take the drug, you need to do this, you need to, and he will just stop you and say it's not for me. So make sure to identify your patients before starting your PCE session. You need also to introduce yourself as a pharmacist, because, you know, at the pharmacy, sometimes there is a pharmacist and there is a pharmacy technician and there is a seller, etc. So you need to make sure that the patient knows that you are the pharmacist. This will increase also the trust between you, because he will or she will know that you are the medication expert, and the information you provide will, let's say, pass more easily. You need to explain the purpose and the expected duration of the counseling session. This is very, very important, because you cannot just start, you can not just start and say, listen, sir, you need to take the drug 3 times a day, and you start with the session without explaining or without taking, first of all, the permission of the patient and telling them how long do you expect this session to last. Generally, when we do the PCE session, for example, we give students 10 minutes to do the whole patient counseling. So you need to explain this to the patient in order to make sure that they have the time and they do agree to receive the patient counseling. You need also to determine the patient's primary spoken language. This is very important. For example, here in our region, we have people speaking different languages. We have Arabic, French, Shawi, maybe sometimes English. So we need to make sure that we know which language our patients understand in order to address them correctly, and in order for the information to be understood by them. Also, you need to make known that everything you discuss with the patient is private and confidential. This is very, very important, because this will help the patient open up to you, because they will know that whatever information they will share with you, it will not be shared with someone else, and this is part of course, of the professional secret. Now that we have talked about the introduction, we will move to the body or the content of the patient counseling. I like always to divide the patient counseling into 2 parts. We have the first part, which is the information gathering, which means it's the collection of information from the patient. The aim of this step is to assess the patient's knowledge about his or her health problems, and also about their knowledge about their medication, because we want to avoid repeating the same information that the patient knows. So we need to check first what they know and whether the information they have is correct or not, and later on continue with our counseling or with our information provision. In order to do so, we need to ask both open and closed-ended questions. I guess you are all familiar with open and closed-ended questions. Of course, open questions are the kind of questions like what we call the WH, what, why, how, when, etc. And closed-ended questions are the questions that have generally just a short answer like yes or no or something else. Why do we need to make sure that we ask both kind of questions, and we need to use as much as possible open-ended questions? Because open-ended questions will let the patient open up to us and explain what they already know. This will clarify what the patient knows, whether what he knows or she knows is correct. It will help us also gain time, because we will avoid repetition. And also, it will help us make sure that the patient is really paying attention, because we have all noticed that whenever we ask a lot of closed-ended questions that have like yes and no answer, the patient may say just yes or no, but he is not really meaning that, because maybe he is not paying full attention, or he's distracted, by something else. So I will give you here some examples of questions that we may ask. You are not supposed to take these questions as they are for your PCE contest, but it will help you a little bit to understand what kind of questions we generally ask to the patients. So first of all, we need to make sure that the medication is for the patient, and this is part of the identifying the patient. We need to make sure that this is the first time the patient uses the drug, because if it's a drug already used, we need first to check how he or she is using it and what kind of information does he or she has on this treatment before providing additional information. Another also question that we need to check is what does the patient know about his condition and medication. Sorry, there is a mistake on the question. It is about your condition and medication. It's not condition and condition. I will correct that. So we need to ask them what kind of information do they have. Did their physician explain something to them about these drugs, etc. We need to ask what symptoms do the patients have, and when did these symptoms started. Why symptoms are important, I always insist when I evaluate students during the PCE session on this question, because when we ask patients about the symptoms, we can later on, when we give the advices, explain to them when should they expect the symptoms to disappear or to start to be relieved, etc. So the symptoms are like kind of indicator of the evolution of the disease or the condition itself. Do not forget to ask the patients if they have any allergies. Of course, this is like an important question that even without patient counseling, we need to ask it, because we need to make sure that what we are going to dispense to the patient is not something that will be dangerous for this person. We need also to ask them if they are taking any kind of other prescription or non-prescription medication. And of course, whenever possible, we need to check for interaction between the drugs we are going to dispense and the drugs the patient is already taking. When we have a female patient, we need also to ask if the patient is pregnant or breastfeeding, but I guess with regards to this question, we need to be a little bit, let's say, intelligent. You cannot, for example, go for a woman, for an older woman, who is like 70 years old or 80 years old, and ask her, "Are you pregnant?" It seems a little bit weird. Same thing goes for like little girls. So we need to make sure to ask the question when appropriately is logical. Sometimes we need also to ask about the weight of the child if the drug is for a kid, and mostly generally when it's a pediatric prescription, the weight should be mentioned on the prescription, but whenever it's not, we need to check for that. Now that we have finished with the information gathering, we will talk about the information provision. So with regards to the information that we give about the medication or about the health condition in general, there are a lot of information. I tried to give you some questions that I inspired from some articles, but I will try to summarize them in the future slides. So when you receive prescription, after you do your introduction, after you make sure to gather the sufficient information that you will need to give some information about the medicine. And you start first of all about the generic or brand name. And of course, generally we use the brand name because it's easier to memorize and easier for the patients, unless we notice during the discussion that our patient is actually a medically trained person. Before starting to talk about the posology of the drug and how we take it and all the other information, we need first of all to explain to the patient how the drug works. I guess this part is always missed by pharmacists, or let's say not always, but generally it's in the majority of cases it's like ignored. And I guess it's really, really, really important because when you understand how something works and why you are taking it, you will be more vigilant, you will be more careful for not stopping it. And this is something I have experienced during my small modest experience in clinical pharmacy. Is whenever I explain to the patients how this drug works, of course not to go through a complicated mechanism of action, but at least to simplify it, the patient is more, let's say, receiving of information and is more vigilant about the drug. So when you explain how it works in simple words, like for example, I will give this example for my students, the clinical pharmacy course. For example, you take PPI or omeprazole, and you explain to the patient that this drug is supposed to block, there is a pump in the stomach that secretes the acid that causes you this heartburn, and the drug comes first and blocks this pump, and it will not will prevent it from releasing this acid that will hurt you. And when the patient understands this mechanism, he will later on also understand why he is supposed to take it at a specific time of the day. Like for example, in the case of PPI, you should take it. It's better to take it like first thing in the morning, before 30 minutes, at least 30 minutes before breakfast, in order to give the drug the time to work before the pump starts to secrete the acid due to the food that you have taken. So this will help enormously even the proper use of the drug. Also, how long it takes for the drug to start working. This is, I guess, the question that interests most of the patients. Every one of us, even us when we are patients, we are always looking for the time onset of action. When does this drug will start working? Should I expect immediate relief? Does it take several weeks? Like give you, for example, for some treatment for anxieties, some of the treatments take several weeks in order to give their effect. So we need to explain to the patient that he or she needs to be patient, and that the effect will not be immediate. That if he or she does not feel an improvement within a week, it's normal. It's generally, for example, taken more than 4 to 6 weeks in order to starting feeling better. And so each drug has its specificity, of course, and you need to explain this in a clear way to the patient. Also, how often to take the medicine per day? Should we take the drug twice daily, once daily, or more? And how many, or how much, drug do we need to take at one time? And at this point, you need to be clear. For example, you cannot say to the patient, you need to take 3 tablets a day. 3 tablets a day, I guess it's a very vague and large expression that has a lot of interpretations. For example, someone may understand that he or she needs to take the drug like 1 tablet 3 times a day. Someone else may understand that he or she needs to take the drug like 3 tablets once daily. So you need to make sure that the information is clear, and you need to say it correctly, you need to take 1 tablet 3 times a day. So please pay attention to this point. Also, when to take the drug, you need to explain to the patient, of course, should the drug be taken before, during, or after meals? Because not only the efficacy of the drug depends on the right time of use, but also the safety of the drug. Some drugs, when, for example, taken before meal, may be dangerous for the patient, or the opposite. When taken after meal, they could be dangerous. Some other drugs may be or may lose their efficacy when they are taken, for example, during the meal, and they should be like there should be a space between the meal and the drug. Let's say, for example, the example of iron. We should explain to the patient that it's better to take it like outside of the meal, and to avoid it with certain kind of meals, for example, with tea, calcium, etc. But if, for example, there is pain when taking the drug, we can probably take it during the meal, but the efficacy will, of course, decrease a little bit. Same thing goes for the drugs that are taken at that time or any other special time of the day. Also, just to open a bracket about this point, some of the drugs, for example, need to be taken in a sitting position, in the right position, and we should not, for example, lay down when we take them, because they may cause, for example, esophagitis. So this also needs to be explained to the patient. How to take the drug? Is it a drug that we take with a cup of water, also with a glass of water? Does it a drug that we need to put in the water in order to dissociate before taking it? Should it be taken with fruit juice, for example? And how much water do we need to take, etc. So all this information also need to be explained. How long it will be necessary to take the medicine, we need to explain to the patient for each drug that, for example, some drugs we say until the pain is relieved, for pain reliever, for example. For other drugs, for example, we can say, no, this is an antibiotic, there is a time course, you need to respect the time course. Even if you feel better, you need to finish the medicine and not stop it. Some other medication is prescribed, for example, for a specific duration of time, 3 weeks, a month, etc. So all this should be explained. Another important point is what to do in case we forget to take the drug. What to do when we miss a dose. Should we take it immediately after we remember, or should even if we remember it like the other day or the next day, we should take twice, or should we just skip that dose and go with the next dose? All this is specific to each drug, and you need to explain this clearly. And of course, you explain what kind of food and drugs or drinks that should not be taken at the same time of your drug, like I explained for the case of iron. The list is still long. We need also to explain the side effects of the drug, any possible side effects, but of course we should not go through the whole list. We should generally explain the most frequent side effects, because otherwise the patient will be like frightened by the medication and he will just say, I will not take it. So make sure to explain the most relevant side effects, explain to the patient how can we avoid these side effects, and if they appear, how can we manage them. And of course, if this side effect appears, how long does it generally take to go away? Like the case, for example, of some drugs that gave GI problems at the beginning, but like, for example, within 3-4 days or a week, the side effects will disappear. We need also to explain to the patient when to seek help if they encounter a problem. For example, patients who are under warfarin, we can explain that whenever you have a sign of hemorrhage, like or bleeding, like for example, you can have bruises under the skin, or if you see that your stool is black or your urine contains blood, you need to seek immediate healthcare, because this may mean that you are taking more drug than you are supposed to. Also, we need to explain how to store the medicine, for how long, so the expiration date. If the drug is like, for example, for a chronic condition, we need to explain to the patient when he or she should come back for a refill, in 3 months, in 6 months, wherever. Insist, of course, always on the necessity to complete the course of the treatment. Do not stop the treatment. Explain to the patient why he or she should not stop the treatment. Explain the drug-drug interactions or the drug-food interactions, and provide, of course, recommendation about non-prescription measures, or what we call lifestyle changes. For example, if the patient is having common cold, we can ask the patient to take, for example, 3-day rest. He or she needs to also to be well rehydrated, that he should take vitamin C, etc. So all this is also welcome whenever possible. And of course, any other information you feel is specific to that patient or to that medication. So I took this slide from a report published by the College of Pharmacists of British Columbia, that summarizes what I have said. So in the patient counseling content points, you have the patient, you have the drug, the direction for the drug, the precautions, of course, you need to take, and how to monitor, which is the important point for the patients, how to monitor the improvement or the evolution of the condition, the monitoring of the side effects, and any other points related to their treatment. Now that I will try to provide you with some useful instructions that will help you in the last part, which is the provision of information. In order to make the provision of information understandable by the patient and easier, you need to use both oral instructions and visual aids as much as possible. For example, you can take the medication from the box and try to show the container and try to show to the patient the colors, the size, the shapes, and if, for example, the drug needs to be taken divided on 2, you need to show them, for example, the mark on the tablet, how to divide the tablet on 2 and take to split the tablet on 2 and take just 1/2. So you need to use this as much as possible. For any other types of drugs, for example, oral liquids or injectables, generally we have kind of syringes that come with the drug. We need to show the patients the dosage marks on the measuring devices, and make sure that we explain to them where to stop exactly when taking the drug. When it comes to, for example, to other devices, like, for example, nasal or oral inhalers, you need, of course, to show the patients how to assemble that device and how to use it correctly. And of course, this is one of the most important points, because studies have shown that, for example, for asthma patients, many of the uncontrolled cases were due to the improper use of the inhalers. And I guess this is the role of the pharmacist, not someone else. And of course, in addition to all this, you can provide written handouts. Either you write them by hand, or you can give them leaflets or any kind of other written information provided, for example, by pharmaceutical laboratories. Finally, we arrive to the conclusion. I don't mean the conclusion of the presentation, but I mean the conclusion of the patient counseling session. We said we have the introduction, we have the content, and we have the conclusion. When it comes to the conclusion, we need to verify that the patient understands, of course, by asking them for their feedback, Do you understand me? If there is anything which is not clear, please feel free to ask me. You can ask the patient to repeat the information for you in order to make sure that what they understood is really correct. And of course, you need to summarize the key points, what you have provided, because you may have provided a lot of information, but you need to summarize the most important points. And make sure, of course, to give the patient the opportunity to express any concerns. If they do not understand, or if there is something unclear, you should give them that opportunity. And of course, we need to encourage future counseling, which means we need to remind the patient every time that he or she can call us or drop at the pharmacy for any further questions. We can also, as I said, provide them at the end a written educational leaflet that will help. And even though you are the one who provided the counseling, but the patient has been patient actually and has provided you some time, so always remember to thank the patient of their time, and this is part of the pharmacist's courtesy, of course. With regards now to the communication skills, I have now explained to you how the procedure goes, but we need to know that as you have seen, there are a lot of information in the patient counseling. However, when we are well trained and we have the good communication skills, we can go through all this information in like about 10 minutes. So that's why we now insist that in the curricula of pharmacists, we always have something about communication skills in order to make you better counselors, and in order to make sure that you will receive the necessary training that will help you gain time and be both thorough and concise. So I start about, first of all, the verbal communication skills, because we have also non-verbal communication skills. With regards to the verbal communication skills, we need, first of all, to make sure to use the language that the patient understands. So generally, the patients most of them may not be from the medical field, so we need to avoid using the medical jargon. For example, instead of saying this drug is used to decrease your, or it's indicated for your hyperglycemia, we need to use the term, for example, increased blood sugar, not hyperglycemia, because hyperglycemia may not be a term that a common person may understand. Same thing goes, for example, for myocardial infarction. We say heart attack instead of myocardial infarction, and I'm sure you have a lot of other examples. However, when the patient is medically trained, now we can feel free to use any medical term, and that's why we always say to our students, please remember to always adjust your vocabulary to your audience. So when you talk to the patient, you will notice if he or she is medically trained, or you can even ask. If it's the case, you can feel free to talk in medical terms. Otherwise, it should be a non-medical jargon. Also, when it comes to communication, verbal communication skills, you need not only to pay attention to the terms you use, but also to the way you say it. So you have to have a logical flow. So do not jump between around ideas. Like, for example, talking about the side effect, then going back to the indication, then going back to the storage, then going back to something else. This may confuse the patient, so try to avoid this kind of the counseling, and be let's say, as organized as possible. Try also to be thorough, which means to give the necessary information, but also to be precise and concise. Do not talk like for hours. Try to give the exact information in the exact way. Do not forget to listen to your patient. When the patient is expressing something or is explaining to you some points, try not to interrupt them. Let them finish, and this will encourage and will help you to have a correct and helpful relationship with your patient. Always remember, it's true that it's called patient counseling, be counsel, but it's always a conversation. It's a dialogue. It's not a monologue. So you are not supposed to be talking all the time. This should be like going and going back. It's supposed to be like a sending message and receiving a message or having a feedback. Also, one of the most important points regarding the verbal communication skills, you need to show the patient that you are trustworthy. By trustworthy, I mean that he can have confidence in you, that you are someone who has who knows what he or she is saying. So this is very, very important. And also to show that you are someone who is caring, which means that you are not really just acting like a machine, but you are a human being who is caring for the patient and who is really relating to them and trying to understand the patient's feeling and trying to provide the most convenient information in order to make them feel better. However, you need to make sure always to use empathy and to avoid sympathy. So empathy is, just to summarize and to make it simpler, is to show to the patient that you relate, that you understand them, without using like some kind of expressions or some kind of acting that show that you like feel sorry for them or you feel pity for them, because no patient wants to be like wants to feel like they are looked down. So you need to avoid anything that makes them feel like you are having pity. For example, when a patient expresses some concern, you can say, "Oh, I understand. This could be really difficult," or "I understand that this must have been really difficult for you." But you cannot say, "Oh, poor guy, I feel so sorry for you." So this one is actually something that the patients should not receive from a pharmacist. I hope you understand this point. And finally, we go to the nonverbal communication skills. For nonverbal communication skills, there are a lot of points to discuss. I always like to use this kind of summary of the communication skills. Actually, it has been first established by Gerard Egan, who gave something called Solar, with each an abbreviation, and with each letter representing a specific expression. However, I use this one, and I need to give credit to my professor Sarah Burrows in Jordan, who gave us this one, and it was really, really helpful. So I feel free to use it, but I need to always give him credit for that. So when it comes to nonverbal communication skills, remember to get closer. So what does it mean to get closer? It's not to get closer in distance, but it means that you need to remember each letter, C, L, O, S, E, R. So C is to control any kind of distraction. For example, do not talk to the patient and explain to the patient while you have a beeper or cell phone ringing, or for example, when you are showing a gum, or when you are biting your nails, or playing with your hair, or for example, tapping with your feet or shifting feet. You need to always remember that the patient counseling, if possible, should be, first of all, be undertaken in a place, a private place, in a place dedicated for that. For example, in many pharmacies, mostly in the developed countries, you find like a specific area for patient counseling. But if the pharmacy itself does not allow, or the structure itself does not allow to have a specific or a private place, you can just take the patient to a side and try to control as much as possible all the other distractions in order for the patients to be focused with the information you are provided. The L is represented to lean in slightly, which means do not stick to the patient. I'm not asking you to stick, but is to be closer a little bit to the patient, do not take distance, because this is like normal human nature. Nobody wants to feel like you are taking your distance. You need to keep an open posture, so no crossed arms, no crossed legs. You need to have an open arm, which means that you are like receiving and you are receptacle of the person in front of you. Remember always to smile, of course. Sorry, before going to talk about that, do not also forget to keep an open post. Sorry, I talked about that. Remember to smile. Of course, the smiling is very, very, very important. Smile, not laugh, because it's also in the human nature. When we are smiling, we are more trustworthy. We are more like caring to the patient than someone who is not smiling. Maintain the eye contact. Try to keep an eye contact with the patient. Do not stare at your paper or at your phone or at the medication. Of course, you do not need to keep the eye contact like 100% of the time, but at least at 75% of the time you keep the eye contact with the patient. And finally, relax. Do not show the patient that you are stressed, because when you show the patient that you are stressed, you may feel them, you may make them like suspect or doubt the information that you are given, and he will feel that you are not sure of what you are saying. So please remember this point. And that's all. With regards to the patient counseling session you are having, I understood from our pack that this time, since it's a specific session, we are used to have it like in presence and face-to-face, but this time, due to the pandemic condition situation, we need to make it online. So I understood that you will receive several cases, and every 48 hours you will receive a case, and you will have almost 48 hours to respond to that patient counseling assignment. So I will let the RPEC explain to you the procedure for this year more thoroughly later on. But if you have any question now regarding the PCE, the patient counseling in general, you can ask me now, or if you want, you can also contact me. Feel free to contact me on my email address that you see on this slide. So, is there any question? Thank you.
So thank you, Dr. Amrani, for the presentation. Please, who have any questions or anything to say, write it in the chat box. Okay.
I need to go to the chat box, maybe?
Yes, of course. You can turn off the presentation.
Yes, I added. So I have just noticed that some people are asking about the languages. This year, exceptionally, generally I do the PCE into two parts. I do the PCE as an event, as a workshop, and of course we have the conseil aux patients that we do as a TD, so as a practical course for the 5th year students. This year, in order to gain time, and since both of them will be held online, I felt like I need to do both of them at the same time. So if there is any problem with the English language, I have no problem in explaining in French later on. just send me your questions either here or my email or on the Facebook group we have for the 5th year, the study educational group, and I will explain to you as much as possible. Is there any other question?
So I think there is no more questions. Thank you again, Dr. Amrani, for your time. I know how much you are busy, and just accepting to do us this session is really means a lot to us. Thank you.
No, it's always a pleasure, and do not hesitate to send your questions. I will be glad to answer. Good luck, everyone. Stay safe and take care of you and your families, and see you soon, hopefully.
Okay, thank you.
Assalamu alaikum.
Alaikum salam.
Thank you.
So everyone, before قبل ما نخلصوا لا غينيون اللي عندهم دي كيستيون راح حطيت لكم دكتور عمراني الايميل تاعها تقدروا تبعثوا لها ثما لي كيستيون. و بور لي ممبر تاع البي سي اي ولا اللي راهم حابين يشاركوا في ليفينمون و بوفي ريستي استناو برك الاخرين يخرجوا سينو نبداو نحكيو ديريكتومون. بون بريفمون هاد العام بي سي مش راح يكون كيما مالف باسكو راح يكون اونلاين. اللي كان راح يتحطوا في لاباج فيسبوك تاع الاخباك و اون باراليل راح يتحطوا في لاباج انستغرام. بون لي كا هاد المره راح فو بوفي ريبوندر على لي كا هذوك شوفوهم دان فورمولار و راح نحطوا شاكا دورون راح تبقى 48 اور دونك شاك 2 جور نحطوا ان كا فيها دي كيسيون تكون سو فورم دان اوردونونس اي راح نحطوها في لا باج بوبليك و سو كي فو بارتيسيبي راح يعمروا الفورمولار ou à condition pour être considéré comme un participant في البي سي اي il faut noter que لازمكم au moins ou la minimum تعمروا 3 sur 4 ولا تجاوبوا على 3 sur 4 كا ولا فورمولار ولا كيلكو سوا دونك اللي رايحين يعمروا وحده ويحبسوا ولا يلحقوا الدوزيام كا ويحبسوا دونك ils sont pas considérés comme des participants و par conséquence مش رايحين نبعثوا لهم الاتيستاسيون في لا فان تاع ليفينمون دونك باش تعتبروا كمشاركين في الايفينمون باش تديو الاتيستاسيون كي تحطوا لي كا في الباج فيسبوك تاع لاخباك كل يومين راح نحطوا كا وراح تبقى 48 ساعه ونسكروها من بعد نحطوا الكا اللي بعدها دونك ال كونديسيون باش تسماو دي بارتيسيبون تعمروا 3 من 4 3 sur 4 من لي كا دونك غروسو مودو هذا واش كاين. الا عندكم دي كيسيون كونسيرنو لا بريزونطاسيون تقدروا تبعثوهم لعند الدكتور عمراني ولا دي كيسيون كونسيرنو لي الايفينمون تقدروا تبعثوهم لي بريفي ولا تقدروا تبعثوهم لا في الباج تاع الاخباك. جو بونس هذا واش كاين لازم نقول. فوالا دونك الا ما كان حتى كيسيون جو في فيرمي لا سال.